My name is Taylor Goodwin. I am the Safe and Healthy Schools Coordinator for the AOE, sitting on the operations team. And we are very pleased to once again have New Solutions join us today. They are partnering with the AOE to provide quite a few resources around school budgeting, which we are very thrilled to have them do. So I'm going to go ahead and turn it right over to Nate Levenson and his team over at New Solutions. Go ahead, Nate.
Great, thanks, Taylor. Afternoon, everybody. I see a number of familiar faces, so the hardcore who can't get enough of this, and maybe some new folks as well. Today is the last session in this series that focuses on staffing, and then we will begin 3 sessions that transition to talking about how to communicate about the budget and build support for your budget. But the last discussion today around staffing focuses on the role of mental health and counseling. To put this in context, if we were having this discussion 20 years ago, I'm not sure we'd even be having it because 20 years ago, schools did not do a lot of mental health and counseling. Certainly in the last 20 years, it's become a mainstay of what many districts see as their purpose and mission. It has also become very clear that it will be hard to be academically successful without also meeting some of the mental health and counseling needs of our students. And so it is no surprise that in this day and age that when we think about staffing and budgeting, mental health services deserve some time and attention. But I think the other reason we wanted to include a session that was really exclusively focused on mental health and behavior support is that we know 2 things from your own actions. We know that when you got extra money from the government through ESSER and post-COVID and during COVID, this was an area in which a lot of school districts across the country and a lot of school districts and SUs in Vermont said, hey, if we've got this money, we know exactly what we should do with it. We should beef up our mental health and counseling services. As that money goes away, a lot of districts are challenged with, hey, how do we keep all those services that we added because we really needed them, because the need did not go away, but some of their funding did. So today's is actually a surprisingly upbeat discussion of how to maintain and even expand counseling, mental health, and behavior support services, even though some of the funding that helped grow them has been shrinking. So we're going to dive into that presentation, and hopefully you will find it of great value and your kids will be able to continue to receive these really important services, even as the dollars get tight. So let me share my screen. Are folks seeing my PowerPoint?
Looks good.
Outstanding. So what do we know? A few things for those of you who've been here before. I'll move fairly quickly through this, but for anybody new, clearly this is a partnership between New Solutions and the Vermont Agency of Education, which we are appreciative of. We want to answer your questions, but we're not going to do it in these sessions because we wanted to keep these sessions short. Take a picture with your phone of the QR code, and that will allow you to submit a question. We will then respond to your questions in writing and also produce an FAQ answers to the most common questions that we will post to the AOE's website as well, so others can see the answers to your questions. A reminder that we really want to, as we think about anything coming related to strategic budgeting, that we are being technically thoughtful, but we're also being politically realistic and practical for the Vermont context. And hopefully you will find all of our recommendations meet all 3 of those requirements. So let's start with the most basic understanding, at least how I think about this challenge. And that is schools will never have enough social workers, mental health counselors, and behavior experts, even with the influx of ESSER funds. I've yet to visit a school that said, hey, if we had one more person, we'd have nothing for them to do. So we know the need is really, really large. And so I want to talk to you about not just maintaining the level of services you have now as the dollars get tight, but really, how do we increase the amount of services as the dollars get tight? So 3 thoughts, and we'll talk about each of these. The first is to prioritize counseling time with students. The second is to take advantage of telehealth. And the third is to consider utilizing insurance-funded services. Let's talk about each of these one at a time. Now, I know if you've been on these other sessions, this idea of how much time folks work with kids has been a very recurrent theme. Talked about it with reading teachers, talked about it with special educators, but there's a really interesting twist that makes it it's important, but a little bit different when we think about counseling. It's similar in that we want to maximize how much time counselors get to spend with kids. But what's fascinating to me is if we think about a counselor's schedule or a mental health professional schedule for a week, there's the time with kids and there's everything else. That's not, really new. But what's really interesting to me is what gets scheduled first. What is the thing that drives the schedule? What we have seen, having interviewed an awful lot of mental health folks, social workers, counselors across Vermont and across the country, is what we have seen is that meetings and paperwork and working with outside partners, community resources, all the things that are not with kids actually get scheduled first. And that they use whatever time is left over to do counseling. So I want to say that again. A lot of the counselors we've talked to, when we ask them, how do you determine how much time do you get to spend counseling kids? They've basically said, it's whatever time is left over after everything else has been scheduled and done. But then we'll ask them, what's the most important thing you do? And they say, work with kids. And we said, then why do you schedule that second into the leftover part? And they said, that's just the pressures they're under. They get invited by people who have power and authority, like principals, like special ed directors, like central office. So what we're seeing is that how much time a counselor spends counseling isn't really determined by them. It isn't really determined by the district as a whole. It's determined after a whole bunch of different people make a bunch of requests on them. And that does not seem to be leading to the outcomes we want. So what do we see when we look at how much time social workers or mental health counselors spend with students? This is national data, but we've done this work in Vermont a number of years ago, and we saw very, very similar results. So the first thing you'll notice is this is a chart of how much time social workers spend with students. One thing you'll notice is that it varies a lot. Each line was a social worker, and some of them are spending twice as much time with kids as others, not because they're better or harder working, it's because they had more leftover time to do that. But you'll also notice that these numbers are not very big. The average amount of time a social worker in a public school spends with kids is about 1/3, 30% of their week. That means for every hour that they're working with kids, they are spending 2 hours not working with kids. That's a pretty low number for a field that's really valuable, that you are short-staffed on, and that the kids aren't getting as much services as we want and they need. Then the other thing I want to point out, because when we get to this point, and I've said, hey, it's about 1 hour out of every 3 is with kids, I'm often asked, but I guess that must be what social workers need to do, because it is pretty standard across public schools, but it doesn't have to be this way. So the other group that we interviewed social workers and mental health counselors who work in community settings, who work with kids. These are only folks who work with kids to do counseling. if they're in private practice or in a community center, they actually spend on average about 87% of their time with students. So all the paperwork and all the meetings that they need to have, they're getting that done in 13% of their day. And yet these people went to the same colleges where they go to a community center or a school, but these folks, depending on where they go to work, either spend nearly their whole day with kids or less than half their day with kids. And I'll tell you, the folks who are with kids most of the day are much happier as well. So I want to really acknowledge that we have somehow created systems and structures and pressures that do not allow social workers to spend even half their day with kids on average. And we can change that. And I've worked with school systems that did the following. This is a weirdly simple decision. I've worked with school systems who went to all of their social workers and counselors, and they said, we want you to build your schedule in which 2/3 of your day is with kids, and then fit all the other stuff into the leftover time. And if it doesn't fit, go to the principal, go to others and say, hey, I can't come to your meeting, or I'm going to have to leave early, or we're going to have to do it next week. So I do believe there's this huge opportunity to empower the social workers to schedule time with kids first and put everything else in the leftover. And if you did that in many school systems, you would double the amount of services overnight. Ideally, as we've said, some people even go as far as setting the expectation that 75% of a social worker or counselor's time would be working with kids. That still leaves enough time to do the other things. So that's the first big idea, set a standard. The second thing that can also dramatically increase how much services mental health and social workers can provide is to move beyond one-to-one counseling. When we look at how counseling is done in public schools, most of it is one kid at a time. But with the research and what the community centers have shown, that having a mix of one-on-one and small group counseling is even better. So we want to move from mostly one-on-one to one-on-one plus small groups. And the small groups, it turns out, really can be much more impactful. This is not just about helping more kids, but it's about being more helpful. Because what we've seen when you have a small group, and again, you're going to form these counseling groups with kids with some similar challenges, what happens is the kids see that they're not alone. They see they're not the only one with these challenges. They actually can see and learn from their peers coping mechanisms, or there might be a student in the group that's a little further along in their journey and in a better place, and they can be encouraged to see that things can get better. So these small groups are actually good counseling, not just efficient counseling. And so having a mix of one-on-one and small groups, very powerful. So go from mostly one-on-one to we're seeing as maybe a gold standard is that 50% of a counselor's time is one-on-one and 50% is group. We're seeing that kids get, again, one-on-one and group, both. And what does that all mean? If you did all the things I just recommended, getting the time with kids up to 75%, getting half of the counseling hours to be in a small group, if you did both of those things, you would provide 7.5 times more hours of service with the same staff. I just want to say that one more time because it always blows my mind that these two changes done together give you a 7.5-fold increase in the amount of hours of counseling you're able to provide without spending $1 more. So if you lose a couple staff members, but you still implemented these two strategies, you would still be providing more service today than you did at the peak of the ESSER funding. So that seems like I'm hoping that motivates some folks to go forward and do that. Now, one last thought about how do you get more hours and more effective hours out of the staff you have, and that is to allow some specialization. Here's what I mean by that. One of the roles that does counseling in many systems, not all, are school psychologists. School psychologists are a really interesting job title because school psychologists tend to both conduct assessments for special education and help manage the IEP process. It's a very special ed kind of part of their job. And they also, some of them do mental health counseling. What we're seeing is that most school psychologists do some of each. But when we talk to school psychologists, we actually found out that some really like doing the IEP part, and some are really skilled and trained at doing counseling. And so if you can allow the school psychologist who likes counseling to do counseling most of the day, and the school psychologist who likes doing IEPs and conducting the IEP process to do that most of the day, even though we have not added a single person, we're making the counseling more impactful. And that's just a no-cost way to, again, keep our staff happier and get folks who are really good at something doing more of that thing. So if you do have that kind of specialization, though, I do want to acknowledge, because your schools are small and you will generally not have two psychologists in one building, that it may mean that some of your staff have to share schools. Like these two folks might be in 2 schools or 3 schools, but every time they go to a school, they're going to do IEP stuff or they're going to do counseling stuff. And I think we've overemphasized having one person in a building and underemphasized letting folks play to their strength. Second strategy I want to talk about, if the first was getting more out of the folks you have, is to start thinking more about taking advantage of telehealth. Even before the pandemic came, and because we all became experts at Zoom, but even before the pandemic came, in the adult world, mental health counseling had moved online in a really big way. During the pandemic, we moved a lot of things online. One of those things we moved was counseling with kids online. And what we have found from research, you can see on your screen just one recent study, but we've seen this in real life as well, that online and virtual counseling, they've been studied a lot. They're really effective. And kids, this is a new generation. Kids and adolescents, children and adolescents, they are completely comfortable having these kinds of discussions over Zoom. So why am I suggesting that we embrace telehealth? Because one of the other challenges we are seeing in Vermont is that you all, particularly if you're in a more rural area, you do not have a ton of folks to hire. There is a staffing shortage for mental health counseling. And if you can't find enough folks who live near your schools, obviously telehealth, you can be recruiting staff from anywhere in the country. The other thing that's really fascinating about telehealth services is that they have really high direct service time. And by that, I mean, they do spend 75, 80, 90% of their time counseling. It's just a really interesting thing that if I had to join a meeting by Zoom, I'm more likely to say no. I'm less likely to be invited. And so telehealth counselors do a larger percentage of their week counseling than in-person counselors. So I think for both finding the folks we need and having this be very cost effective, telehealth can be really very beneficial. And the last thought I want to share with folks is because we're going to have fewer dollars to pay for all of these mental health services that we want, is we want to consider utilizing insurance-funded mental health services. It turns out that health insurance will pay for some of these services so the district does not have to. And that's a nice thing if we're running short on money. Now, at this point, a lot of people start to worry about, hey, but not all of our kids probably have health insurance. We know many of our families are in tough places financially, but nearly all students in the United States have health insurance. Now, not all of their parents have health insurance. I totally get and appreciate that. But the figures I've read put the number at over 99% of students in the United States have health insurance, most of which covers at least some quantity of remote mental health services. They also cover in-person mental health services, but I've found that this idea of pairing the remote with insurance has been really effective. So the first thing you want to keep in mind that many of your kids already do have the insurance that will pay for it. Now, if they have insurance that would pay for it, I guess you could make the case, well, why don't their parents or guardians just go out, find a mental health provider, get the services, and then pay for it through their health insurance. And what we've seen is that for many kids, their families are not in a place to navigate the mental health system. Some of the parents aren't even aware that insurance would cover it. And so we have found that the schools are actually very well suited, very well positioned to facilitate parents and families accessing mental health services, even if it is their own parents or the child's health insurance that's going to pay for it. So I still think there's a very big role for schools in helping families and parents and guardians access the health insurance benefits. Now, if you're going to go in this direction, it does take some energy. So even though the insurance pays for the services, you still need to make a small investment because you're going to need a person to research and manage these external providers. For example, so while these services are free and fully covered, and therefore cost the districts nothing, they just don't happen overnight. They don't happen by accident. So you are going to need, I don't think it's a full-time person, but you're going to need somebody who becomes knowledgeable about what services are covered, what are the major insurance carriers in your state, what do they allow, who will take the insurance. You don't want to make every family have to do that. That is the hurdle that gets in the way. So if you work in a larger area, Champlain Valley, for example, you might be able to look for insurance-funded providers that are in your community. So real life, live folks who will come into your building to provide these services. In a more rural area, you're more likely to be looking for virtual providers. But again, you need a point person who is doing that research to identify these providers and to work with them. Now, interesting enough, if you're a very small district, and many I know are, you might even consider sharing this mental health community service coordinator position with other districts nearby to reduce the cost of getting set up. So you don't even have to do this alone, because this tends to really fit a regional solution pretty nicely. And just to give you one example, and this is a first-hand example. So as a superintendent, I actually did not have enough mental health and social workers, and my budget definitely could not add what we needed. And so I did wonder, could we go out and use insurance? Could we go out and find these local folks who would then bill insurance? And what we did is I spent about $20,000 up front as an investment for a part-time leader to do all of this research and to do all of the coordinating and to do all of the negotiating. And at the end of about $20,000, which was 6 months of a part-time person, we started bringing in $1 million in mental health services for our students, and it cost us almost nothing. Insurance paid for virtually everything other than the salary of the coordinator. And even that, with $1 million worth of services, we did not even need a full-time coordinator. So I just want to give that example. Yes, I was in a slightly bigger district, in a slightly more densely populated, but it really shows you for what a relatively small investment can lead to really significant amount of mental health services for kids. And as dollars get tight, we might need to start looking at these kind of approaches because we might not be able to afford to expand or even keep all of the counselors and social workers we have. So that is a fairly quick walk through a set of strategies for expanding. And I really want to stress this. My goal in today's session was not to just to maintain the amount of counseling you do, but it was to actually expand it, even if your budget for counseling shrinks. So that concludes our 7 sessions on staffing. And as I mentioned, starting tomorrow, we will be talking about the communication aspects of budget, talking about how to build understanding and support for budgets. And then on the 18th, we will be sharing with you a fully presented template for what is a great budget presentation PowerPoint, a tool that some of you may want to use and make your own and customize. Lastly, again, we wanted to get your questions. I'll leave this slide up for a moment. Take a picture of it if you haven't. Also, hopefully in the chat, we've put the link to a Q&A form. We will also be hosting, after the holidays, office hours. If folks want to join us and ask their questions in person, we'll be doing that as well. And with that, I hope this was helpful.